everyone, my name is Abida Bashir and I'm presenting
Please start the
PhD
presentation.
in clinical research. Today my presentation is about psychological effect of infertility and some way of treatment. This is my, as you can see, this is a very important topic because infertility is a very common among the couples because somehow the definition of the fertility according to WHO is when some couples who are sexually active for 24 months and trying for a baby, and if they're not able to get pregnant naturally, they are classified as infertile. So somehow when WHO says that 24 months of active trying, it's mean trying actively on the days when you have the ovulation, not on the other days of the month. So when you're ovulating and you're trying for 24 months actively and not getting pregnant, then it's mean that you drop into this category. There are different clinical practices to know about this infertility, that how and the reasons as well, but we will go in detail in the next slide. Okay, so as I mentioned before, today I will not go very much into the details of what cause the couples not able to conceive, but I will go into the psychological impact when couples are not able to conceive naturally for a certain amount of time. What are the psychological impacts they have on them? So you can say that these psychological impacts can be due to the reason because they're not able to get pregnant, or they can be due to the medications they are using, because different people have a different reason and there are different treatments available as well. And these treatments, as I mentioned before, and these treatments can induce a lot of psychological effects. Medications, especially as these medications are related to the hormones, they don't regulate your cycles. They hyperstimulate your cycle if you're going through the IVF or ICSI or other fertility treatments. So these medications have a lot of side effects. They can be for the time being, and they can be for some longer time, because as long as you're using those hormones or medication, they can have a side effects, and those side effects are related to psychological impact as well. Then there are some impacts due to the finances, because if you're going through the treatment, these treatments in certain countries come with a lot of financial implications based on the geographical region where you're based. The cost is different, but at the end of the day, these treatments are not very cheap. And if someone is going through a lot of the cycles, a lot of the treatments, it means they have a continuous financial implications related to these projects, related to these treatments, and therefore it can affect the mental health of the person because they are under financial stress. And all over the world, and this is just an info for only 10 to 15% of the couple which are in the reproductive age, not when I say reproductive age, it's mean that it's a bar according to WHO when someone from the puberty age to before they go to menopause for the women's, and the man as long as they're sexually active and the sperm health is good. So that comes under reproductive age. So still people, when they drop into this bar, still they 10 to 15% of the couples are facing the problem, and this problem, as I told you, that it is under address problem at the moment because people think it's not a medical condition, but it is. And now, what's the problem? According to the one study which was done in the Sweden EU, 3 separate factors seems to contribute to the psychological stress in the man and the women who are facing problems. And they're facing the infertility problem. And these factors are somehow put in the order. First, in terms of the woman, how women's the thing that in the terms of the rating, the women feel pressure because first factor is having children is a major focus of life. Somehow the women naturally like to have the children and the family, and it is a major part of their life. So when they're not able to have a family, they come under a lot of pressure, and it does affect their mental health. And secondly is a female role and the social pressure. It changes according geographical as well. In a certain region, the women role is being mother, being wife, having baby, raising a family. So if they're not able to fulfill this role, there's a lot of social pressure as well. But in the certain geographical countries, there's a less stress on the women to have a family, and they have other roles in the society to fulfill. And the third one is effect on the sexual life, because sexual life, the people feel more fulfilling when they are able to achieve the result, and if they're not able to achieve the result, they think that their sexual life is not very optimistic in the way. But again, as I told you, this order was done according to the women's. From the men perspective, it goes slightly other way around, because the one which is a major focus of life, it can't be for the men, because for the men it's more about that the female counterpart that they have has a objective or should have a babies. So it goes other way around for the men. The factor 1 becomes 2 for them, and factor 1 become 2, and 2 become 1 for them. And the third factor is quite equally significant to both of men and women. But somehow it has came to the light that the women feel more pressure, it has a more psychological impact on the women when they're not able to have babies than the men. And the women have naturally more intense desire to have a baby. So that's why when couples, they're trying to have a family, are trying to conceive, when they're not able to have a baby, the woman is the one person who has a more mental stress than the man. Because again, the stress is related to the desire, how much strong desire they have to have a family. There's another studies as well which found that incidence of the depression in infertile couples is significant higher than the ones which are fertile. And when I say that, it's mean that the people who have an unknown reason not to have a baby, because sometimes out of the 10 to 20% couples who are not able to have the baby, nearly 50% of them don't have any pathological problem. So it's unknown reason, and medical research is not able to support and not able to find out the reason. So those couples which have no reason are under less stress than the couples who have a reason and a pathological condition where they're saying they're not able to have the baby. So somehow there is a big bar knowing the reason for infertility and not knowing the reason for infertility, and an anxiety change according to that. Okay, so there are a few things which you can do when you are under stress. The first one is psychotherapy, relaxation techniques, and relaxation techniques change again based on the availability. In a certain, for example, in India, people can have a lot of meditation based on the local available yoga and other spiritual things. Might be in some other countries more to do with the other techniques are available locally. So, but again, it's all about applying a locally available techniques which can relax the person and take their attention away from the problem for time being, because stress does contribute. It is also found out that stress contribute apart from infertility to the conceiving of the person. Then the counseling. Counseling, you can have a counseling and it helps as well, and then medication. And I think the medication should be the last resort because medication does come with their side effects as well. So might be for the time being you will feel relaxed, but all those anti-anxiety products have their own side effects. So long term, it's not a good strategy to have a medication for stress. So I would prefer to have the first 3 techniques to use for the relaxation and to deal with the psychological stress which you are having if you are going through infertility. The next one are the results which I came across quickly. The psychological challenges of the infertility can be overwhelming. Yes, it is. And it's very well known and understood that most patients come to some conclusion. Either they go through a lot of treatments which are ICSI or FIT or IVF, and they're lucky enough to become parents to the biological children, and that's the most fulfilling thing for them to have, because they go through a lot of the cycles of the treatments and a lot of the medications, and finally they have achieved something. So it was all a fruitful journey. Second option, the most of the people they adapt is adopting children. Again, it is fulfilling, but not as much as having a biological children. And third one is deciding to build a life without children. And to be honest, the last resolution is a hard one, because the people who are going through the treatment for a very long time, it's very difficult for them to come to this term that they will live there with no offsprings. But again, as mentioned, they have to come with some resolution in the end, because if they will not, it's a constant stress and mental stress. If they are continuously there, it just destroys your mental health. And sometimes it's not reversible. For many couples presenting for infertility treatment have a high level of psychological distress associated with infertility. And when I say that, it's not that the people who are going through IVF or ICSI or FIT or IUI, all these kind of the fertility treatment, I'm not saying that these treatments are contributing toward the psychological distress. No, it is not, because it is a very little evidence there that these treatments contribute to any mental distress. It is just the stress itself. When people are going through treatment, they are very stressed about the outcome, and they want to have a positive outcome, and it is uncertainty which they are facing, that either it's going to be positive or negative, cause a lot of the psychological distress. And the research has shown that these treatment does not contribute too much distress. It is the person mental health or the way of thinking or uncertainty about the outcome of the treatment which contributes toward the psychological distress of the person. And there are also a growing number of research studies ongoing at the moment, and they're trying to check the stress level of the patient at the different level of the cycles which they're going through. Again, as they mentioned, that if someone is going through the treatment for the first time, the stress level is very high, comparison to the person who's going through the treatment but already have a baby from the previous treatment, their stress level is low. So they have seen that in both cases, the stress was not due to the treatment, but again due to the uncertainty about the outcome of the treatment. Again, as I showed you, this is very under-addressed topic, because there are a lot of the research out there about the treatments of infertility, how the people can have a family, how they can conceive by using these treatments. But there is a very little research out there about the psychological distress of these treatments. So might be what I'm telling you now, that there is a very little distress or mental effect of these treatment on the mental health of the patient. Might be in a few months' time there will be a research out there telling you no, it's not, because these treatment does contribute to the mental health of the person. But again, as I told you, this is based on the present research, and they're saying that treatments IVF, ICSI, and IUI does not contribute to the stress. It is just the person way of thinking and the mental stress about the outcome of the treatment, which is causing more psychological disturbance in the people. In the light of the discrepancy of the results as they are there, and as I told you, there has been increasingly interest in the factor that contribute to the dropout from the infertility treatment, since the population is often not included, and there's not a big data there on the big population, so it's very difficult to figure out. But as I described in the very first slide, that these there are a couple of factors which really contribute. The first one is not able to have family, and second is financially implication, because some people get pregnant after going through a lot of the cycle, and each cycle costs fortune. In the UK, here I was looking at national health research. website and cost you about 6 to 7 grand, which is 6 to 7,000 pounds for the one cycle. So if someone is going through a couple of cycles, it's fortune to spend, and it's a lot of the financial implications. As I told you before, this whole data is very controversial. A lot of research is going on. People are trying to figure out what is causing the psychological distress in the people, and is that due to the medication or not, or is it due to the treatment, or it is due to the personal health. But again, it's a very open topic. Still, research is going on. And people are working on it, and hopefully in the future we will come across some more certain answer about it. Thank you very much everyone for your time. These are the references. If you have any question, please feel free to ask. And again, I apologize because I make you wait so much due to these technical glitches. Thank you.